Parham Doctors Hospital Joint Replacement Center, your new lifestyle with a total hip replacement. In the comfort and familiarity of your own home, you can now continue your recovery and literally take new steps to an improved lifestyle. When you begin walking, you should have little discomfort. Here are some guidelines to remember. Always use your forearm crutches or walker, bend your knees as you walk, and use the heel-toe gait you learned in the hospital. It is a good idea to walk every 1 to 2 hours during the day, gradually increasing the distance. You may go for walks outside as soon as you feel comfortable. Have someone with you the first couple of times you venture outside. Watch for slipping or tripping hazards. Walk on flat, even surfaces when possible, and avoid grass or gravel-covered areas. When climbing the stairs, place your good foot, the non-operative leg, on the first step. When going downstairs, place your crutches and operative leg on the step first. Remember, going up, good foot first, going down, operative leg first. Do not squat or bend forward past 90 degrees from a standing position, or bend over to pick up something from the ground. When you sit, use a straight back chair with arms. Bend your knee at a 90-degree angle when sitting and place 1 or 2 pillows in your chair to raise the seat height. Do not sit in a position that would cause your hips to bend at an angle greater than 90 degrees. Do not pick up objects from the floor when you are sitting, and do not cross your knees at any time. Sit with your knees apart. You will need to bend both knees getting in and out of the chair. Do not sit on a sofa, deep cushioned chair, rolling or swivel chair, rocking chair or recliner, and do not sit for more than 45 minutes at a time. You should rest in bed at least 1.5 hours in the morning and 1.5 hours in the afternoon. It is good to have a nightstand table nearby on which to place your crutches. Be sure to use 2 large pillows between your legs, whether you are resting on your back or on your side. Do not lie on your stomach. Keep your knees apart. Do not rotate your foot or knee inward when lying, sitting, or standing. While in bed, either before or after resting, this is a good time to do your foot pump exercises. Follow your hip precautions to get out of bed. Remove your pillow. With your knees facing up, bring both legs to the edge of the bed. Bend your knees and use your hands to push yourself up to a straight position. You are also advised to avoid sex for 4 weeks. You may take a shower if your incision is not draining and you are able to get in and out of the shower. Do not scrub your incision, just let the water run over it. If your incision is draining, call the surgeon's office. Always use an elevated commode seat for 2 months after surgery. You cannot drive a car when you go home. Your surgeon will discuss this with you at your follow-up visit. For low cars and bucket seats, a pillow or 2 should be placed in the seat. For all cars, slide the front passenger seat back as far as possible. Place the seat in a semi-reclining position in order to provide plenty of leg room. To get in the car, turn your back to the car with your legs touching the door frame. Reach back behind you for the seat and slowly lower yourself onto the seat. Be sure to pivot on your buttocks with your knees apart and toes straight. Be careful not to lean forward or twist. Do not forget to fasten your seatbelt. It is best to let your driver do this for you so you can avoid twisting in your seat. To get out of the car, unfasten your seatbelt. Move your legs out of the car first and use the door frame to push up and out of the car. Again, do not lean forward or twist as you do this. From now on, when you visit the dentist or your other doctors, it is important to inform them of your joint replacement. You will be given a joint replacement identification card when you are discharged. Be sure to take this with you and always show it at your appointment. Before visiting the dentist, we may recommend that you take an antibiotic at the time of your appointment to prevent infection in your new joint. You can get this medication by calling your surgeon's office or from your dentist. When you call to make an appointment, be sure to tell your dental office that you have a joint replacement. A serious complication of lower extremity surgery is blood clots. Clots can break loose and travel to the lung. Your surgeon will prescribe a blood thinner or anticoagulant to take at home. Follow the surgeon's directions. Notify your surgeon if you experience any of these side effects: increased incisional drainage, bloody or black tarry stools. You may also have black stools if you take iron supplements, coughing up blood, nosebleeds, bleeding from the gum, vomiting blood, or material that looks like coffee grounds, or bloody urine. Pain medication will be prescribed for you to take home. Some common side effects you may notice from your pain medications are nausea and constipation. Make sure you have eaten something at least 30 minutes before taking your medication. Eat plenty of fiber and drink 6 to 8 glasses of water each day unless you have a medical reason not to do so. When you finish the prescribed pain medication, you may take Tylenol or extra strength Tylenol as directed on the bottle. If your pain is not controlled with your pain medication, rest and apply ice. If your pain is still not controlled, call your surgeon. If you need additional pain medication, call your surgeon's office during business hours. There are additional symptoms that you should watch for: drainage from your incision or worsening redness around the incisional area, increased swelling that does not decrease with elevating your legs in bed, dramatic changes in your lower leg size, increased calf tenderness, increased pain, fever greater than 101 degrees, persistent nausea and vomiting, no bowel movement in over 3 days. Your surgeon may order visits by a home health nurse. The nurse is there to answer any questions that you may have. Your vital signs will be checked. The nurse will check for signs of blood clots. The nurse will also check your incision. If you are going home after discharge from the hospital, your surgeon may order physical therapy visits if needed. Walking is the best therapy for recuperation following surgery. Unless you have an emergency such as chest pain, or you are unable to get your breath, or an emergency that requires a rescue squad, call your surgeon for any concerns. Our surgeons like to talk to you directly or see you in the office regarding routine post-operative concerns. We at Parham Doctors Joint Replacement Center are here to help you with your new joint. Please feel free to call us with any questions or concerns. We believe that your joint replacement will greatly improve and enrich your lifestyle.